Have you ever wondered why your child seems to always get sick during the winter? Why do those coughs and sniffles always make an appearance when the temperature drops? It's actually no coincidence. Respiratory viruses thrive when we're all huddled together indoors during the colder months. But what exactly happens in our bodies when these viruses strike? Today we're diving into how respiratory viruses work, how they trigger symptoms like cough and stuffy nose, and what it all means for your family's health. Welcome to the Health Exchange Podcast. I'm Dr. J. Rutland. You might know me as a pulmonary critical care physician, and my fascination with health obviously starts with the lung. But why? It's because your lungs are your front door, constantly exposed to and interacting with the outside world. Every breath you take is a snatch of the environment or air full of molecules and germs that enter your body. Every molecule exposed to the cells that line your lung. Inside those lungs of yours, it's not just about oxygen. There's a whole network of cells exchanging information, just like Savannah and I are gonna every single week. In fact, all the cells in your body communicate and transfer information. And here's the kicker. It's that cell-to-cell communication that leads to disease. So as we dive deep into your cells that talk to one another, we're gonna reveal what that means for your health and how you can take control. So get ready for this journey into the fascinating world of health, science, and medicine. Welcome to the Health Exchange Podcast. We're your hosts. Let's get started. Savannah Shiles, co-host, welcome.
Thank you.
Tell us about yourself.
Yeah, so I am a adult gerontology acute care nurse practitioner. I've been working in cardiology and electrophysiology for the last couple of years. That's where my heart's at. I've been an ICU nurse, CCU nurse for the last 11 years. Started my career as a CNA when I was really young.
What's CNA stand for again?
Certified Nurse Assistant.
Cool.
The beginning of it all.
Yeah.
And then transition, got my registered nurse, did telemetry and fell in love with the heart. That was the beginning. And did telemetry for a couple of years and then made a transition over to ICU, CCU. That was my true passion. Loved everything about it. Loved learning about the heart.
Yeah, ICU is great.
Yeah. And then while I was working full-time as a nurse, I was doing my nurse practitioner program. So I just lived and breathed the hospital 7 days a week.
Now, when you were a CNA,
Yeah.
was the goal, you were like, I'm going to be a nurse, I'm going to do the ICU,
100%.
I'm going to be a nurse practitioner? Yeah.
Literally from when I could walk, I was like, I'm going to be a nurse. My dad was a electrician at the hospital where I lived locally. And back then, he would take me to work with him. And he would pawn me off to the nurses, which you could never get away with now.
Right.
But I would follow the nurses around all day and help them out. And anything they asked me to do, I would do it. And I was in awe. I just loved it. I loved their knowledge and how they took care of people. It was everything.
Was there a nurse that you think about back then? Is there a particular name?
That's a great question. There isn't somebody specific. It was all of them. It was really all of them. Yeah. So that started my love. Yeah. And then my entire life, if you asked me, what are you going to be when you grow up? It was a nurse.
What was your earliest eye-opening experience in the hospital? You were just like, whoa.
First thing that comes to mind is I was working telemetry. We had a patient that came in emergently. They had had a massive heart attack. We ended up needing to do a cabbage, right then and there. And just as a new nurse, seeing how quickly everybody was moving to make sure that this patient was going to be taken care of, I was like, I want to be that level of high speed. And I think that's why ICU is I'm like the nurse that wants to be first at bedside doing chest compression.
Oh yeah, I get it.
You know.
I do know. And now that you're kind of outpatient now, right?
Yeah, yep. I do mostly outpatient.
You miss the ICU.
Oh God, I miss it. But to be fair, I run over to the hospital and I walk through the ICU and I'm like, I'm okay. I'm like, I miss it, but also clinic is not a bad place to be.
No, not at all.
No, I love it.
Not at all.
Yeah.
I think that when you work in the ICU every single day and you have that compassion with your patients and their family members, I mean, it's like real life. It really gives you
real life.
Yeah. It gives you a sense of how finite life is.
100%.
Right. And it gives you a sense of how real illness is and can be, right?
Yeah, and how we can heal people.
Right.
I mean, we really make such a big difference. So I do miss that connection. Now being in clinic, I'm seeing patients every 15 minutes. The dynamic's completely different. But my goal now is how do I take that when I was seeing patients for 2 to 3 days and making it so meaningful? How do I translate that and at least give my patients in clinic a few minutes of that attention?
It's got to be hard because
really
nowadays
hard.
we're seeing like 30 people in clinic a day, 40 people, sometimes
Literally.
50.
Yeah, literally. There's a balance there
Yeah.
for sure. But I make it work.
And it's wintertime,
Yes.
which is really interesting because when you understand respiratory viruses, which is the peak right now, right?
Yes.
Winter season, peak of respiratory viruses. You know what else it's peak time for?
Do tell.
Myocardial infarctions.
You're not wrong.
Right.
So I've been discussing this in clinic the entire week because we're going from Thanksgiving into Christmas into New Year's. And this is when I see all of these patients coming in. They're fluid overloaded, blood pressure's through the roof, adjusting medications nonstop. So it's a lot of education about what are we going to do at Christmas time?
Yeah.
How are we going to make good choices?
Right.
You know?
It's really interesting. And, you know, what I find really compelling about respiratory viruses is, you know, individuals like us, people in this room right now,
Yeah.
when we take our big breath of air and we snatch everything that's in the air to the inside of our body, these respiratory viruses, what they actually do is they bind to the cells that line our lung, that line our upper airway and our lower airway. And that initiates this disease process, right? That leads to coughing and shortness of breath. And we were talking about our kids earlier, not our kids, but we each have our own
kids,
set
yes.
of children, right? Like, and how they got sick over the last few days. And what are the
Oh my
things
goodness.
that you're seeing, like in your own children?
Remind me how old your kids are.
My kids are older. My kids are 12 and 9 now.
Okay. So mine are 5 and 3.
Yeah.
Literally last night, I was telling you earlier, I was up until 2 a.m. Hayden, who's my 3-year-old, picked up who knows what at school for the millionth time.
Yeah.
Started as a cough, little, respiratory situation. And then last night, pretty sure it turned into a full-blown ear infection. So we were trying to deal with that all night. But my kids, I can count, I swear, on one hand, how many days they have not had a runny nose in their life.
Yeah.
It's like,
It,
it's a lot, right?
Yeah, especially as their immune system develops as they get older, right? They're 3 and 5. Their immune system's not all the way developed yet, so
Yeah,
they're
no.
still being exposed to things, getting used to things. So
It feels like it's getting better as the years are. Does it get better?
it does get better.
Okay, tell me that.
Yeah, it does get better. I mean, so again, there are many types of respiratory viruses, right? We've all heard of influenza or flu. We've all heard of respiratory syncytial virus or RSV.
Yep.
We've all heard of coronavirus, probably ad nauseum, right? Whether it's COVID,
True.
SARS-CoV-2, or whether it's the kind of traditional common coronaviruses, which infect everybody every day as well.
Yep.
Then there's other kind of lesser known viruses that infect people, like metapneumovirus, rhinovirus, which is common cold virus.
Yep.
But there's so many different types of viruses that once they infect you, they really cause issue. When you look in children, right, the common ones that we see, influenza, RSV, we do see SARS-CoV-2, adenovirus, right?
Yeah.
Can cause pink eye conjunctivitis.
Seeing that a lot right now. Seeing pink eye a lot. RSV a lot.
Oh, yeah. And we want to try to protect our kids, right?
Yes.
And as a parent, right, I'm a pulmonary critical care physician. So I understand respiratory disease. I understand respiratory viruses. But when my kids get sick,
Oh,
I still get scared,
100%.
right?
You don't want to go to Google, but you want to confirm that what I'm thinking is actually
Is accurate.
is the treatment plan. Yeah, 100%.
And it's like, I remember once I was on call in the ICU. I was like a second year pulmonary fellow. And my wife was at home with our oldest now.
yeah.
And our oldest had temperatures up to like 104 degrees, 104 and a half degrees. And with every spike in temperature, she had a seizure.
Oh, goodness.
Yeah. And so she had these febrile seizures, right?
Wait, did your wife know that connection? That
She had no clue.
Okay,
she
exactly.
FaceTimed
Yeah,
me,
yeah.
right? This is when FaceTime's like a new thing.
Right.
She FaceTimes me, and every time my daughter was like, "Wah," and she was,
No.
it was so scary, right? And I'm looking at it, and then once she got out of it, and it was like a second, 2
Were
seconds.
you in doctor mode or were you in dad mode?
You know what's funny is it's really strange is I was in both.
Okay, well, good.
This is something that we'll probably get into at some point, but it's very difficult to get out of doctor mode, right? While I'm being a dad, but it's kind of like, well, which emotion is taking priority right now?
Oh, yeah.
Right? Because
I hear
dad
you
mode's
on that.
like, holy shit, like, what the hell's going on?
Yeah.
Doctor mode is like, she's clearly having a febrile seizure. Let's bring her in. So I had her bring her to the hospital, tested her. She had respiratory syncytial virus, which makes perfect sense as to what was causing her issues.
Yeah.
Bring down that temperature. And at that time, because this is like 2016, 17, what you can do is just supportive care.
It's always supportive care, you know? Yeah. Well, good. She's okay.
As somebody who's watched his daughter get that sick, right? It kind of stimulated me to truly understand what was happening. And it motivated myself to really study why people have fever, to really study what's happening in the body when somebody is infected with something.
Yeah.
Right? And so when you look at respiratory syncytial virus it's an RNA virus, right? We have all heard the term DNA, right? DNA becomes RNA, RNA becomes protein. Basics, right?
Yeah,
Basics of science, all right? So when you look at respiratory syncytial virus, it binds to your cells with something called the glycoprotein, the fusion protein. It fuses with your cells. And this is where it gets its name syncytia from, because syncytia just means a bunch of fused cells together.
Right.
It fuses with your cells, and then it dumps its genetic material on the inside, and then it wreaks havoc on your body. And one of the things that we have to understand as a society, and I'm looking into the camera for a reason, is we have to understand the way the body naturally works. And I mentioned this a little bit in the opening, right? Your body is a bunch of cells that all talk to one another. When you're looking at infection, what actually happens with infection is once the virus enters your body, and you can see what a virus looks like if you just Google virus, or maybe we'll even put a picture here for you. It's going to bind to your cells that line the lung, right? And your upper airway. When it binds to those cells and it puts its genetic material inside the cell, your cells understand it's under attack, right? This is infection. When your cells are under attack, they're going to call for help. And the way that they call for help is they release molecules that we call cytokines and chemokines. What these molecules actually do is they just tap on the shoulder of the immune system and let the immune system know, like, hey, somebody's over here trying to infect us. Like, I need you to come over here.
Get over here.
Yeah,
Let's
get
take
over
care
here.
of this.
Right. And the lung is essentially a bunch of pipes that lead to a bunch of balloons all stacked on top of one another. That's the lung. That's all the lung is. Now, the pipes are surrounded by muscle, right? The balloons are surrounded by blood vessels, but that's all the lung is. And so what actually happens when you have a respiratory disease is you get an infiltration of the immune system, that is the white blood cells that are designed to protect you, into the areas of the lung that are supposed to be used for gas exchange.
Right.
So all these white blood cells end up in your balloons, and your balloons are full of white blood cells instead of full of air. And so you get short of breath.
Yep.
Right? You can't breathe very well because you can't gas exchange very well because your airways are occupied. Right? It's really quite simple. And based upon how activated your immune system is, that tells us the severity of the symptoms that people are going to have. And it really doesn't matter what the virus is.
Right.
The reason people have less severe disease is either because they've already been exposed to this virus, so the immune system's not tripping. The immune system's like, oh, that's Claire. Like, who cares?
We've done this already.
We've dealt with this, right? Or your immune system just isn't activated, right? There are some people that don't have functioning immune systems, and viruses and bacteria and fungi can just kind of invade the body, and you won't have any symptoms. Right? Until you have a really serious symptom and you're in the ICU or something like that. But that can happen as well. But I really think it's important for people to understand that communication, that infection stimulates the immune system, And the immune system's presence and activation is really what causes symptoms. That's really what disease is.
Right.
Right? The reason you have a fever is because viruses and bacteria can't withstand that temperature. Their membranes break down. They start to die off. Our cells can withstand a higher temperature.
Yeah.
And so that's why your temperature goes up.
What would you tell parents for their kids who are running a high fever? When do they have to be worried about it?
Yeah. So for me, when that high fever leads to
This
consequences,
is dad and
like,
doctor answer.
Yeah. When that high fever leads to consequences like seizure, that's when you're worried.
How do we avoid the seizure?
You got to bring the temperature down, right?
Okay.
Because that means the temperature is too high.
Yeah.
Right? But that's one of the things. The other thing is looking at your kid's behavior. Like if your kid is still being him or herself or themselves, and they're running around the room and they're doing their thing, like I'm not tripping. Like they have a fever, they're running around the room, that's fine. If your kid is not acting like themselves, they don't have energy, they're not engaging with you, engaging with their brother or sister, engaging with their friends.
Something's serious.
Something serious.
Yeah,
Because you got to determine as a parent, like, is this a bacteria? Is this a virus? Is this a fungus?
Right.
Right? And so you really have to understand your child's medical history.
Right. Well, we hear this as moms and dads with babies, right? We are always worried about them being sick. And then you take them to the doctor and they're like, are they eating? Are they drinking? Are they going to the bathroom? They're probably good.
Right.
So it sounds like that kind of theory carries on.
100%.
Yeah.
It 100% carries on. And the thing about it from a physician perspective is that we want to know exactly what's causing these symptoms most of the time. So we might test people and look for respiratory syncytial virus, right? COVID, SARS-CoV-2, influenza. We might want to know these things because there are a certain population of individuals who are susceptible to severe disease.
Yeah, right.
So if you look at kids who are 0 to 5, they can have severe RSV disease, right?
Let's jump into that. Let's talk about RSV.
Yeah. So as I mentioned earlier, like respiratory syncytial virus is an RNA virus, and it houses 11 different proteins, which is what leads to the severity of illness and its illness, right? So when it binds to your cells and it activates the inflammatory response, you get this rush of the immune system into the areas of the bronchioles, which are carrying air to the lung, and the alveoli, which actually perform gas exchange. When your alveoli are full of white blood cells and virus material, it's a pneumonia. That's all pneumonia is. Pneumonia is a collection of inflammatory products in the balloons of the lung.
See, and I feel like a lot of parents don't think about pneumonia in their kids.
Right.
You know, we don't really we're thinking, when we think pneumonia, we're thinking of the 80-year-old patient. But I was just reading statistics where kids between the ages of 0 and 5, that's the leading cause of death is pneumonia.
Right, 100%. And that's the worry. So it becomes this question of, does my kid have pneumonia? Again, if your kid is really short of breath,
right?
If you see retractions in their, what we call the scalene muscles, like in between the clavicle here, if you see that they're trying hard to take a breath.
To take the deep breath,
That's worry for pneumonia.
Abdominal breathing.
Exactly.
Yeah.
Abdominal breathing. Those are the worries for pneumonia. Really, really fast breathing. Kids breathing like 35, 40 times a minute, right? Or if you ask your kid, hey, do you have a difficult time breathing? If they can talk, if they can tell you yes, like that's a serious thing.
Oh, yeah,
right?
that's a straight to the ER thing.
That's a straight to the ER thing. When you think about RSV, one of the things that RSV does, again, I'm an immunology nerd. Like, I get that. I know that. I got no problem with that.
We love you for it.
Right. One of the things about RSV is RSV, the virus, it wants to live, right? If you consider viruses living.
No,
whatever,
sure, yeah.
Right. So what is it going to do? So the way the body actually works is the body wants to activate what's called a type 1 inflammatory response. This is just a name for an inflammatory response. It involves a molecule called interferon. Again, this is just a name. This molecule is important for clearing viruses, clearing cells that are infected with viruses, clearing viruses in general. That's what this molecule does. What an RSV has is it has proteins that inhibit the production of this molecule. Because it does that, your immune system wants to do something, And so it upregulates what's called type 2 inflammation. We're going to get into that in the asthma patient. But what happens is type 2 inflammation gets upregulated. So these patients produce a lot of mucus and they wheeze. And they look like an asthmatic patient.
Yeah.
Because they're coughing, they're wheezing, they're producing a lot of mucus. So a lot of times parents are like, how can I tell if my kid has RSV? Sometimes, and again, nobody's God, so you really can't just be like, that's RSV.
That's RSV, right,
That's
right.
flu, right?
Yeah.
You can't really do that. But there are times where if the patient, the kid, is producing a lot of mucus, if they're wheezing and coughing, probably more likely to
There's a high probability.
Yeah, probably more likely to be RSV.
What should we be telling parents or family members on how to prevent
RSV.
RSV?
Yeah. Difficult. Here's the thing.
Right.
Recently, there is a new medication called Nirsevimab, which was approved for kids who have at-risk chronic illnesses.
Oh,
they
interesting.
have asthma. They have, they're immunocompromised. Their immune system doesn't work very well. They're premature.
Okay.
What we recommend giving is before that first RSV season or during that RSV season, we give a dose of Nirsevimab, which is a monoclonal antibody that blocks RSV's ability to bind to our cells.
But these are very specific patients we're referring
So
to.
every kid 0 to 9 months should get it.
Okay.
Right? That's born like right now. Should get it. If they have a chronic illness, it's like 0 to 18 months or something like that.
Right,
If they're
right.
premature, if they have something in this list of chronic illnesses, and you can very easily look this up online, they should be given this product or offered the product.
Okay.
So a lot of people say, oh, it's a new vaccine. It's not a vaccine. It is an antibody that's given that lasts a long period of time floating around in the bloodstream and binds to the F protein on RSV, not allowing it to bind to the cells. So these kids don't have severe disease, and it's like 90% effective. This was just
that's
published
impressive.
a couple days ago, like a couple weeks ago. It's 90% effective now, like for that first RSV season. So it's one of these therapies that has massively changed how RSV severity presents in kids, right? It's saving hospitalizations. It's saving lives.
I was going to say
likely.
it's saving lives. Yeah.
Right.
Yeah. Very
So
good.
that's what we do for that. And again, there's an RSV vaccine available, but that's for adults that are 60 and up. And it's also for pregnant females between, I think it's like 34 and 38 weeks or 36 and 40 weeks, something like that.
Yeah.
They can get a maternal RSV vaccine. And what it does is it generates antibodies that are protective for the kid. Because if you're breastfeeding,
Yeah.
that's how the kid gets their immunity is
Right.
through breast
the
milk,
breast milk.
which has antibodies in it.
What other,
Tidbits.
or other viral infections you want to jump on?
So everybody talks about flu, right?
Yes.
And everybody right now is worried about the bird flu, right? H5N1,
Yes.
right? Everybody's all worried about influenza.
There's a different flu every year that we're getting worried about. Yeah.
Of course. So here's the thing about influenza. Now, what we're talking about really is influenza A. There's 4. There's influenza A, influenza B, influenza C, influenza D. Many different types of influenzas. Influenza is also an RNA virus. But influenza A is the one that can cause severe disease. H5N1 is bird flu.
Right.
These letters stand for proteins. H stands for hemagglutinin. N stands for neuraminidase. When you look at influenza, the virus, it has a structure. And the way that we like to describe viruses, we say viruses have structural proteins. That is, if you were to grab, I don't know, if you look at this candle that we have on this table, right? Say this is the outside of the virus. The structural proteins would be like here
Right.
on this membrane, right? And so hemagglutinin and neuraminidase are like on this membrane, okay? So everybody's like, why do I have to get flu vaccine every year? What's the point? Blah, blah, blah. Here's the thing about influenza, and it's actually about every organism that most people don't realize or don't think about, is these proteins are just a collection of amino acids all stacked on top of one another. It's like Legos, right? They're all stacked on top of one another. Every year, these amino acids can change a little bit. And remember, viruses and even our body, for that, our cells, they're 3-dimensional structures.
Right.
So if you change one of the amino acids, or if you change a couple of the amino acids, it
changes the
structure of the protein, right? And our antibodies that we generate when people are infected with a virus or people are infected with the bacteria, our body generates cells that recognize some of these structures. Our body generates antibodies that recognize some of these structures. And it's three-dimensional, right? And so the antibody will recognize it. But if amino acid changes the way it looks, so the antibody isn't as effective at finding it.
Right.
Does that make sense?
Oh, yeah.
So the way I like to describe it is it's kind of like you have, who's your best friend?
I can't say that out loud.
Oh, gosh. Okay.
Do you know how many people I would upset?
You have your top 20 friends. Let's say one of the names is Hillary. All right. So like Hillary drives, we'll say she drives like a Honda Civic.
Yeah. Okay.
And every time she comes to your house, you look and you see the Honda Civic and you're like excited and you're like, oh, cool, Hillary's coming in.
Come in. I got wine.
Yeah.
Oh, okay.
Exactly. I got wine. Exactly. That's it. Right. So like if Hillary got a new car, say she got like a black Range Rover.
Okay.
And she came over to your house and she pulled up to your house and you look outside the window and you see this black Range Rover, you're like a little apprehensive. You're like, who the hell is that?
Yeah.
Like, who's this parking right in front of my window? Who is this?
This isn't my Hillary.
Right. So your immune system, when it's exposed to a virus that's mutated a little bit, one of the structural proteins is mutated, your immune system does the same shit. Your immune system's like,
what's going on here?
What's going on?
Yeah.
And it can over-respond and cause a bunch of white blood cells to come into this area getting ready to fight this infection that it hasn't seen before. But then Hillary opens the door and it's just Hillary.
Oh.
Right? And you're like,
thank God.
Oh. But your immune system can't go back. It's already recruited this army.
Yeah.
And so it's just taking up all this space and all of your inflammatory mediators are just taking up all this space and you're coughing and you're really sick. And so that's what happens in your body, right? This is what's taking place. And these viruses are mutating. Remember during the pandemic with COVID?
Don't take me back to that.
I know. It's so terrible.
We're going to go back to that, but
I know. It activated your immune system in the beginning so much that your immune system is essentially what killed you. Like it was just over responsive, right? And over congested the lung, which is a vital organ.
Right.
And that's what happens with these viruses. And as parents, how do you protect your kids? Well, there are strategies, right? There's vaccination. Vaccination is important because every year we know it's going to mutate a little bit. And we can see how it's going to mutate.
Right.
And sometimes we guess with how it's going to mutate. And so we give the vaccine.
Right.
Sometimes we don't know how it's going to mutate. Like sometimes we do know because sometimes it starts in a different part of the world. And we're like, oh, that's what it looks like. And then we rev up the vaccine.
Right. Yeah.
The other thing is if your kid is sick, like probably don't send them to school to spread infection. Right.
Jamie, careful what you say.
I know.
Careful.
I know.
Because I'm going to ask you, how do I prevent the phone call once a week that Hayden has a runny nose and has to go home when I never see him without a runny nose, right? I get it.
It's hard.
It's really hard, right?
It's very hard. It's very hard because sometimes a runny nose is just an allergy.
Okay, so let's transition a little bit.
Okay.
Why do you feel that we should still care about COVID? It's a big subject.
I think we should care about respiratory viruses in general and being able to differentiate between SARS-CoV-2, the virus that causes COVID, influenza, flu, respiratory syncytial virus, right, RSV. I think it's important to differentiate between those three viruses because those viruses wreak the most havoc in human beings, right? That's one. And then two is there are treatment regimens for individuals that are susceptible or for individuals that become really symptomatic.
Right.
It's one thing to understand that individuals who have lung disease, individuals who have chronic inflammation of the lung, whether it's asthma, whether it's interstitial lung disease, individuals who have dead lung, which is emphysema or COPD, it's easy to see why these individuals actually are more susceptible to respiratory viruses because they don't have that reserve in their lung, right? They have inflammation already. A virus comes, more inflammation, no reserve. You're going to be really sick. So I think it's important for us as clinicians, for us as healthcare providers, to provide that information to patients that could potentially get really sick and give them information on the different therapies, right? So SARS-CoV-2, influenza, RSV.
Yeah.
I talked a little bit about RSV. I said, listen, there's vaccines for individuals who are 60 and over. There's a maternal vaccine for females and their infants that are going to be born, who are about 34 or 32 weeks, whatever, pregnant. And then there is an antibody therapy for kids, a prevention strategy for kids who are born, right? They can get this monoclonal antibody and it prevents RSV from binding. For influenza, because of the H5N1 potential, which everybody's worried about, the bird flu.
Yes.
And again, just to remind everybody, hemagglutinin, neuraminidase, proteins on the outside of the virus. All the numbers are just a type, like what it looks like exactly.
Right.
H5N1, H1N1, all that. It's just a type of protein. But influenza is influenza. And there are oral therapies, antivirals, that we can use to treat it. It's just that as soon as you're symptomatic, that's when we want to initiate those therapies.
How do we prevent it?
Yeah. The way to prevent disease, which is what we're preventing. So a lot of people look at vaccination as preventing infection. Like they'll say some stuff like, well, I got the vaccine and I still had COVID, or I got the vaccine and I still got flu.
Yeah.
Yeah, well, yeah, you're supposed to.
And then they never want to get the vaccine again.
Right. So what people have to understand is that like vaccines don't prevent infections. Vaccines prevent severe disease. So all a vaccine is a little piece of a virus.
Right.
Or a dead or a weakened virus. But I want to reverse a little bit. And this is going to be, again, a little bit of learning. So I'm just going to look into the camera. So when you're infected with a virus, when you're infected with a bacteria, when you're infected with a fungus, whatever it is, these are organisms, right? So they all have a certain way that they look. What your body does, once it sees this organism, it cuts it up into little pieces. As it cuts it up into little pieces, your cells recognize the different pieces. And when they recognize the different pieces, they either make antibodies to recognize one of the proteins, or they make cells to recognize one of the proteins, right? And then when it does that, then your immune system is allowed to go out and clear the virus or bacteria or fungi or whatever is causing the issue. But what happens is wherever the virus or bacteria presents itself, so like in the lung, it's an end organ, right? If your lung is congested, like you could potentially die because it's an end organ, it's a vital organ, it's the only organ that provides oxygen for your body. So that's the danger there, right? Is that process of recognizing the organism, cutting it up into little pieces, and then manufacturing products that recognize these pieces. All of that takes place in the lung, and it takes up space. And that's what can cause your shortness of breath and all of that. That is how an infection works, right? So what a vaccine is you understand the structure and function of the organism. So you know what flu looks like. So what you do is you take little pieces of the H and little pieces of the N, and you put it in a vial, and then you inject it in your muscle. When you inject it in your muscle, right, your immune system recognizes those little pieces in your muscle, not in your end organ like the lung, right? So recognize those little pieces in your muscle, and then your muscle hurts. It's supposed to hurt because that's just inflammation there, right? So when it does that, your white blood cells take that information to the main freeway of all white blood cells. It's called the lymph system. And then it tells everybody what to do. It's like, hey, this is what flu looks like. All right, take this back to your friends. And then it goes back, right? Like that's all it is, right? It's just telling your friends what Bobby looks like. It's like if you were to come over to my house and you didn't know who my friends were, I'll be like, oh, you want to see Jaywalk? He's got dreads. He's about 6'2".
Yeah.
He looks like he played football for USC because he did, right? And you would be
I
like,
like
oh,
this analogy.
right, that's probably Jaywalk, right? And so that's all the immune system is doing with the vaccines. It's like, oh, okay, this is what H&N looks like. Got it. So when flu shows up, your body's like, oh, that's just Jaywalk. That's just Heather. Will you go deal with that? And that's it, right? It's not an overreaction or over response. So when people ask questions like, well, how do we prevent infection. You're not going to prevent infection. The real question is, how do we prevent severe disease, right? How do we prevent our kids from being in the hospital? How do we prevent our kids from being really sick?
Right.
Well, that's what vaccines do, right? Is they prevent your immune system's overreaction to the presence. It's like your immune system knows what's up now, so it's like relaxed about it, right? That's how vaccines work. The other way to prevent respiratory viruses, really simply, and people really hated doing this during the pandemic, it was wearing a mask.
Yeah, or hand hygiene, right? I mean, the simple things.
So we didn't talk about really the 4 ways that people can get infection, right? So there's respiratory droplets, there's aerosols, there's physical contact,
right?
And there's fomite transition, which is Savannah's sick, she coughs into her hand touches the table, I go over there, touch the table. That's fomite transition, right? And then if I bring my hand up to my face and I take a breath, I'm probably breathing in whatever virus you have, right?
This is all our 2 and 3-year-olds.
Right.
This is preschool.
100% preschool.
Yeah.
This is what happens.
This is what happens.
So like you said, it's very important for parents to teach their children how to wash their hands or to wash their hands frequently.
Yeah, well, I think we underestimate it. It's so important to do. I think we got better during COVID.
We did.
Most definitely. But I hope that we don't lose it.
Right.
You know what I mean? Mm-hmm. We got to keep it going.
And people always wonder, like, how come during COVID we didn't see flu as much?
Exactly.
We didn't see RSV as much.
Because we washed our hands.
Because of social distancing, right? It works
because we wiped down tables.
Right. It works for everything.
Yeah.
Right. That's how your body works. So masks, when you are breathing and you have a mask on, if you cough, you're not going to cough out as much organism.
Sure.
Because the mask is serving as a barrier. Just like if you have a mask on and you're breathing in, you're not going to breathe in as much organism. So what does that mean? So if you don't breathe in as much organism, that means your immune system isn't going to activate as much because you don't get that load, right? You're not getting that extreme viral load. So of course, everything becomes a little bit more mute.
Yeah.
And people just have to understand that because that's just generally how the body works. So when you think about prevention, these are the things that you want to think about as a parent.
Definitely.
These are the things that we think about as healthcare providers.
Definitely. So we want to make sure that we're vaccinating.
Correct.
We want to make sure that we're teaching good hand hygiene.
Correct.
We want to make sure that we're wiping down all the surfaces.
Yeah.
What else?
Those are the things.
Those are the big things.
Right. And then
overall well-being, keeping our kids, good nutrition, exercise, diet, mental health, I think plays a huge role in it as well.
Right. Exercise though. Oh my gosh.
Oh God.
It's so important because when you think about it, right? So if you're going on a run, if you're weightlifting, you're basically increasing blood flow all over your body.
Right.
Because you're getting warm. When you increase that blood flow, remember that you don't just have blood vessels running throughout your body. You also have this lymph system, which is the system that basically allows white blood cells to go all over your body. Mm-hmm. So as you're increasing your blood flow, you're increasing your lymph flow, which means that your white blood cells are seeing all sorts of things. And we know that with exercise, your immune system can function more efficiently. It just works better. The more you exercise.
Yeah.
Right?
And this is the same for our kids, too.
Same thing.
We got to get our
children.
kids outside, running around the park.
Eating the right foods.
Because
foods have vitamins that are essential for our body to work efficiently. Mm-hmm. If your kids are eating, McDonald's and drinking Coke, it just doesn't have the same nutrients as an apple or an orange or stuff that grows in the ground like carrots. And so we have to remember that, too. And I get it's hard. It's hard for me to convince my kids to eat these things, but
we all know the battle.
100% the battle.
Show me a parent that does not know that battle, but a battle worth fighting, I think.
100%.
Yeah. Okay, so when we're trying to put into play all of these preventions, and our kid still gets sick, which we all experience,
right?
What's the threshold for calling your primary care doctor versus going down the street to the urgent care versus I need to present to the emergency department immediately?
Right. So this is one of my pet peeves as a clinician. I'm a pulmonologist, right?
I feel this too.
Right. Yeah. You get this, right? I'm a pulmonary critical care physician. So I always tell my patients, listen, if you're seeing me in clinic and you have a respiratory problem, you need to tell me. I don't want you going somewhere else.
Yes.
Because it's going to end up back to me if it's not controlled as well as it needs to be anyways, right? But parents ask me all the time, urgent care, ER, all of that. Here's how I look at it, right? And there's probably a little bit of bias in how I look at it. The emergency room is usually the place where you have the opportunity to seek specialist advice and get more definitive answers.
In that moment.
Yes. They have a more robust testing strategy. They have more access to more tests.
Yes.
They have the CAT scan. They have the x-ray. They have the MRI, right?
Yes.
And so in my mind, if you want to know information about what's going on, an emergency room for me acutely is probably the best.
I agree with you 100%.
When you look at an urgent care, typically speaking, might have radiology. You might be able to get an x-ray. Not always the case. You might be able to get an x-ray. You might be able to get your blood drawn. Also, not always the case.
Yeah, you're right.
You can definitely see a clinician of some type.
Yeah.
But I'm just not certain how much you can get done there.
Yeah, I don't disagree with you.
I think that they're helpful. It
depends the symptoms of the
Exactly.
kid, right? So if they have a runny nose, things seem controlled. We touched on this earlier. If they're eating, drinking, they seem okay. Urgent care is appropriate. You know, you're going to be there for, hours. And if the goal is to leave with a little medicine, that's an appropriate place for them to go.
Right.
If
Life-threatening illness.
feels, or it just feels urgent. Your mommy, daddy instincts are hitting and you're like, I don't know about this. Never fear going to the ER, in my opinion. Ever, never.
Ever.
Yeah.
And if you're asking questions and you're saying things like, well, I don't know if I want to wait 6 hours or 8 hours, either you're not that sick, or B, we probably should get somebody's opinion like that has that background. Like when patients call me and they're like, well, I don't want to wait. I mean, it's just how the ER is. I know it sucks, but that's just what it is.
Yeah, and they'll triage, right? If
will.
you walk in there and something's really serious, they're going to take you back.
Most of the time. we have those horror stories. But yes.
Next
most
episode,
of the time,
the
next
ER.
episode, right? we have those horror stories. One of the things that a lot of people have been talking about lately,
Yes.
from a respiratory standpoint, is walking pneumonia.
I knew that's where we were going.
Right? A lot of people are like, why are we seeing more walking pneumonia? Like, here's the thing, everyone. Walking pneumonia, which is secondary to what's called Mycoplasma pneumoniae, which is an organism that doesn't have a cell wall, whatever. Walking pneumonia is common in adolescents and kids.
Right.
This isn't new. Right? We might be seeing it a little bit more, but it's probably because our testing is a little bit better.
I agree with that. Yeah.
Usually it's an illness that sometimes you don't need antibiotics to treat it. Your body can kind of clear it. But sometimes you do need an antibiotic, right? And the antibiotics to use in this case are azithromycin, a Z-Pak, which you've heard of, or doxycycline, and sometimes even a medicine called Levaquin. But these are the medications that we're using to treat it. Now, in kids, you want to use azithromycin. Doxy can change the color of your teeth. Levaquin, we don't really like to use in children too much, so you're probably stuck with the azithromycin. But again, this is something common that you're going to see in individuals. Now, the symptoms, same as any other respiratory infection, right? Cough, shortness of breath. On CAT scan, and CAT scan is really a special x-ray that slices you up in really thin little pieces, and I'm sure we'll do an episode on CAT scan and the findings and what to look for. But on CAT scan, what you'll see areas of inflammation throughout both lungs, and we call it mosaic attenuation. It's kind of like my kids. It's like a little bit of white, a little bit of black, a little bit of white, a little bit of black, and that's what, mosaic. So that's what you'll see on CAT scan, but it's very easy to treat, right? But you have to think about it.
You do. This is why our kids need to go to the primary care provider, get checked, get the testing that's necessary, do all of the screening to see if the antibiotics are necessary or not, right? Because we also don't want our kids to be on antibiotics if they don't need to be.
No.
So the threshold there, I think the takeaway there is that we make sure that they're following up with their primary care provider.
And it's always hard. I mean, the things that I say to parents are, listen, if your kid continues to have a high fever, and been after 3-4 days, like, they probably need to be on antibiotics because we're dealing with bacteria, not a virus. Well, so it just kind of depends. So.
Speaking on that, what would you say, like, top 1, top 2, top 3 symptoms, if you will, are that a parent should be paying attention to that's like this warrants further look at?
Yeah. Persistent.
Temperature, 100%,
Yeah.
right?
Temperature, 100%. Behavior change, 100%. They're not themselves, 100%. If they have a history of a chronic medical condition, if they have immunodeficiency, their immune system doesn't work, if they have diabetes, if they have chronic kidney disease, if they have a medical history of any type that affects an organ, those kids need to be evaluated quicker.
What about a time frame? So we see a lot of kids who are, coughing, runny nose, or doing this. And it used to be, in my opinion, prior to COVID, it was like, okay, you're sick for 5 or 7 days, symptoms go away. Now we're seeing in adolescents and in adults, right, that these viral bugs are lasting for an exceptionally long period of time. I'm seeing my patients 4, 6, 8 weeks, and they're still presenting with these symptoms.
Yeah.
When do we talk antibiotic?
Yeah. So I think for me, again, I order tests. So I'm looking for evidence of bacteria. I'm looking for evidence of fungus. All of my patients are immunodeficient in some way, shape, or form because I have an autoimmune lung disease clinic. But, in this case, there are post-viral syndromes. There have always been post-viral syndromes. Again, you get infected with an organism. You have a recruitment of white blood cells to an area, and the persistence of these white blood cells in that area leads to symptoms of cough, leads to symptoms of wheezing. Sometimes these kids actually are undiagnosed and have asthma, and so these symptoms last a longer period of time.
Yeah.
Right? We're going to talk about asthma on a future episode, but again, it really depends. That's why I think it's important for you to have access to a healthcare provider.
I agree.
That's allowed to get to know you. And I get that sometimes it's hard, right? I grew up with a single mom. My mom was at work. She couldn't go to the doctor during the hours of 9 to 5 when most doctors' offices are open because she had to work. And then she went to law school at night. So those things make it difficult. But we do have to find a way to allow clinicians to get to know their patients so that we can better treat them.
Especially when they're young.
Yeah,
if you can build that
especially when they're
relationship
young.
with your provider, it is key.
Yeah, very.
So we've covered a lot of viral illnesses.
Yeah.
It's been amazing.
Yeah.
One thing we did not cover, however, your story,
Yeah.
which we need to know.
Well, great question. It seems like it's an easy question to answer, but the more and more I answer it, the more complicated it becomes. But I'm going to keep it simple. When I was a little kid, my grandmother was blind, never saw me. So she had retinitis pigmentosa and never saw me, but lived till she was 95 years old. She was great. Wrote books for a living, Harlequin Romance and her own books. Yeah. So my grandmother had retinitis pigmentosa. My grandmother also had a trach her entire life.
Oh, wow.
Pretty much. She was about 30 years old when she was pregnant with my mom and my mom's twin, and she couldn't breathe. She had had a thyroid goiter removed previously, but I think what actually happened when she had her thyroid goiter removed is they cut her recurrent laryngeal nerve, which innervates the vocal cords there.
Goodness.
And so I think her vocal cords were paralyzed. And so when she was pregnant with my mom and my aunt, she couldn't breathe. They put a trach in, right? So they put a trach in. She left the trach in. She said, just leave it. I can breathe so much easier.
Oh, wow.
So she had a trach her whole life, completely uncared for by a physician since she was like 30 some odd years old and lived till 95. Every night she would cough and cough and cough and cough and cough. Every night. Cough, 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 all the time.
And she managed it all by herself.
All by herself. Cough out all the mucus, cleaned out the trach, did it every day. We had a little.
We are both in the
necklace.
ICU, so if anyone is listening, if you're ICU, you know what a big deal that is.
It is, and
it's
so
a big deal.
It's a big deal, but like for me, like whenever I'm in the ICU and a patient is, talking to me or complaining about coughing,
right?
Or if I see a trach patient, like I cough all the time. I'm like, dude, my grandma coughed for 65 years. She was fine. You'll be good.
You're okay.
You're gonna be just fine, right? So there's that. And then my grandfather had emphysema, which is what ended up taking his life. But when I was 10 years old, I wrote down 2 short-term goals, 2 long-term goals, okay? And 2 short-term goals were like score 20 points in a basketball game, my next game, and like get straight A's, right? Easy goals. The 2 long-term goals were get a scholarship to North Carolina or Georgetown, and then go to the NBA, right? Duh. And then my other long-term goal was go to medical school, become a doctor. And I put it on my grandparents' refrigerator. I was 10. And it stayed there for like ever.
Oh, stop.
Yeah.
That's great.
And so then I don't know, years later, got into medical school, and I went to Iowa, to the University of Iowa, which was a fantastic place. Absolutely loved it. The reason I went there is pretty funny. I'll maybe tell that story one day, but we'll save it.
Was it your wife?
No, it was not. It wasn't her. It might have been another her, but it wasn't her. Not yet. I met her there, though. So I'm in medical school at Iowa, and at Iowa was probably the best thing to ever happen to me because the state of Iowa is so organized and educational. And the way they went about their business when they were educating me as a medical student was absolutely unbelievable. And I became a better student, a better person because I attended this place. And it actually defined what I wanted to do with my career.
That's great.
At Iowa. And I told this story earlier when we were eating lunch.
Right.
So I'm a third-year medical student, and I'm on OB-GYN rotation, and I'm on GYN-ONC. And we had to spend 12 days or 10 days or something on GYN-ONC. So I'm rounding in the surgical intensive care unit. And there was like a 75-year-old female who was essentially dying of metastatic ovarian cancer, and she just had surgery. And when you're a med student, you have the most time. The residents and the fellows are running around taking care of everybody, going to the ER, doing their thing, and you're just kind of sitting there, and you've got like one or two patients, right? So I had this one patient, and this family was from the northwest corner of Iowa, and it was a farming family, and there was a husband, and there was a wife, and then kids. Obviously, when you're a minority, when you're black, and you walk into a room full of individuals that don't look like you can feel tension. You just do. Like, I just know, right? My family, we were always in rooms like that. So you just kind of know. And so in the room, I felt this tension, but I didn't let it bother me or prevent me doing what I came there to do, which was to talk to the family and educate them, let them know what was up, what was going on with Mrs. P.
Right.
So every day I would do this, talk to them. And every day I could feel the barrier kind of come down. I could feel it softening.
Yeah.
I could feel the door opening a little bit. They became more open. I could feel this.
Yeah, definitely.
I leave the rotation. I'm done. I'm gone. The next day, Kevin, who was in my class, who's now a radiation oncologist somewhere, comes into the rotation, and he's talking to Mr. P, and Mr. P literally says these words. He says, "Where's Jamie?" And Kevin says, "Oh, he's on another rotation now. I'm going to be taking care of you guys now, whatever." And he says, "I never loved a colored fella as much as I love Jamie, but I do."
Oh.
And I wrote about it in our medical school paper. And for me, when I wrote about it, I was like, man, he was kind of a little bit prejudiced, a little bit racist. You could feel it in that. But then when you really thought about it, it was like, wait a second, hold on.
That was a huge step for that person.
I spent 10 days with this guy, with his family, and I may have changed their outlook on an entire race of people. Now, you could be pissed off about it, and you could say, you know what, it shouldn't be that way, and it shouldn't be that way. But that lesson for me at that point in time was this is what communication can do.
Yeah.
If you know how to communicate to people, you can open up biases and correct them just because you know how to talk to people. So for me...
And you were just being a good person. I mean, you were just being a good person.
I was just being Rutland.
Yes. Yeah.
I was just being the medical student that Iowa taught me how to be. And
he saw that.
I understood communication. Yeah. And so I knew that at that point, I wanted to communicate and teach individuals so that they could better understand what was going on in their body. And hopefully it would lead to more compliance. It would lead to more understanding, because all of our time on this planet is finite.
Yeah.
And for me, that's how I wanted to make a difference. And so that's what led, I guess, to all of this.
It's beautiful. I'm so happy to be doing this podcast with you.
This is going to be fun.
It's going to be the best thing ever.
Yeah.
Let's talk about some of the goals that we have that we want to share with the audience.
I think for me, one of the goals that I've always had is I understand that pulmonologists, the guys that take care of this thing up here, we're poor marketers. And we just are. And so I just feel like teaching individuals about this organ that's constantly exposed to their environment, and understanding how it works and how it impacts disease in general is extremely important. So I wanted this podcast to be about teaching health and understanding how cells communicate and how that communication leads to disease and how we can correct some of that communication through therapies.
Yeah,
and that was really one of my goals here. How about yourself?
I would say the same thing. I second that. Knowledge is power. And I think that as medical professionals, part of it is taking care of patients, but we also play a huge role in educating patients. And this is an opportunity to take that one step further, take it out of the hospital, take it out of clinic, and hopefully reach a larger audience with the hopes that if we even make a difference in one person's life, truly, it's 100% worth it.
Right.
Yeah.
And the other thing that I think about a lot, and I'm just going to speak into the camera again, is there's a lot of you out there that don't really understand the sneaker game that exists in my closet.
Oh my gosh.
And for God's sakes, you
He's
guys are
taking
going
it
to
to
know
the
about
sneaker
it.
game.
Oh yeah. You guys are going to know about it. So every episode, I'm going to have on a different pair of heat, and you guys are going to love it. And I'm using this podcast to promote
Bring it,
that.
Jamie. Bring it.
Every single time. So not only are you going to learn about health, but you're going to understand the fire that exists in my closet. Period.
I have seen photos and videos because I thought you were joking. And I was like, this is legit.
You received a pair today, did you not?
I did.
That's correct.
I did. I was gifted a pair. We'll see how many episodes it takes before I wear them here.
We're going to find out about that. But I think the other thing about this podcast is really it's going to be a place where we communicate about current events in health.
Yeah, and we want to connect with everyone. We want to connect with the medical professionals. We want to connect with the people, the moms, the dads, the families, people who are interested in wellness. Anyone, I think, is going to find benefit in what we're going to discuss here.
And we want to have open minds, right? Again, one of my favorite quotes from my buddy whose dad told him one time, he's like, I'm not trying to change your mind. I'm just trying to open it.
There you go.
And we want to have an open mind and listen to individuals and figure out what we can do for them or with each other.
And have a little fun while we're at it.
100%.
Okay, so I'm really excited about this. Before we wish you all a healthy new year, Jamie and I want to send you off with this week's Positive Pulse and close out on a high note. Whether it's a patient's inspiring journey, a community coming together, or the latest innovation changing lives, Positive Pulse is here to leave you with a smile and a renewed sense of hope. And I know we might be a couple of new faces and voices to some of you, so I think Jamie has a quick personal Positive Pulse to share with you today.
I do. And there's lots of positive pulses in my life at the current time, but I think I'm going to end with this one. 2 nights ago, I'm at home. And I'm getting ready for this podcast, and I'm putting together outfits, right? What we're going to do, what we're going to wear, how we're going to do this.
You did better than me than I did it this morning.
And I get a knock on my door, and I'm like, okay, who's possibly at the door right now? So I go down to the door, and it's a neighbor friend of mine. And my neighbor is crying, and she's saying, my dad is having some chest pressure. Can you see him? He's in the car.
Oh, no.
So the patient's dad, or not the patient's dad, but my neighbor's dad is from Canada. And what they're worried about is health insurance, right? They're like, oh, do we need to go to the ER? Yes, no. So I go into the car and he's talking to me and he's able to communicate with me and tell me he's been having pressure all day. Feels like an elephant sitting on his chest.
Oh, great.
The wife tells me his blood pressure is 70/42. He's having a heart attack, right? It's like no doubt. So I'm like, listen, you need to go to the ER right now. Mm-hmm. We're not going to play around. We're not going to say, oh, let's see how it goes tonight. You need to go to the emergency room. Goes to the emergency room, having a STEMI, ST elevation, myocardial infarction.
Yeah.
Immediately to cath lab, open up the artery. He had a couple of AFib arrests on the table, but you know.
Oh, my goodness.
The next morning, he's on 2 liters of oxygen, wide awake, feels great.
Doing well.
And you think about that story because, again, it's the holidays. And I don't know about you, but my holidays, my father-in-law died a couple of weeks ago suddenly. I had my wife's father, so it was my stepfather, my stepfather-in-law. My wife's father died during the holidays a few years ago. But I'm just thinking about those opportunities that we have to intervene.
Yeah.
And the reason, at least why we're put on this planet, is to help people and to make sure that people who have the opportunity to move on for the next day
Yes.
are given that opportunity through the knowledge that has been passed down to us. And in that scenario, there was knowledge passed down to me. I knew exactly what it was or what it could be. And the outcome was great. And they get to enjoy Christmas together in a few short days. And that makes me really, really happy.
It makes me really happy. It's a good story.
Yeah.
Well, that concludes episode 1 of the Health Exchange. I think it went really well.
I think so too. Thanks for joining in on episode 1. We really appreciate you guys being here. We're going to be releasing
every Thursday.
Every Thursday, 9 a.m. Eastern, 6 a.m. Pacific.
Yep.
Where all podcasts are seen.